There we go. All right. So thank you and welcome everyone who is joining today's webinar. My name is Dr. Sofia Wenzler. I'm a licensed clinical psychologist and the clinical lead here at SkinPick, the program that is combining online therapy support with personal guidance by therapists in order to help you cope with your skin picking. And today we're going to talk about body image and skin picking, a very interesting topic. My presentation is going to be about 40 minutes, and I want to encourage you to stick around until the end. Firstly, because we're going to have a Q&A session where you can ask each and any of your questions. You can write them down during my presentation in the Q&A section here in Zoom or at the end of the presentation. I only want to ask you to not raise your hand. Just write the questions down in the Q&A section, and I'm going to get to as many of those questions as I can. And also, if at the end or generally you decide you want to try out SkinPick, we're going to have a discount code for you at the end of the webinar that's going to give you a $100 discount for your first subscription. Okay, let me just check. No questions so far, which means that probably also all of you can hear me. Otherwise, you would have written that down. So let's start. In the beginning, I want to talk briefly about beauty standards, and how they affect body image or define also both of those concepts. Then I want to make the connection between body image and skin picking and how body image is affected, usually when we suffer from skin picking disorder. We're going to talk about skin picking and body dysmorphia, which is a psychological phenomenon that I'm going to explain about. And then I also want to give you some more practical advice on how to work on your relationship with your own body and improve your body image. Then we're going to conclude and jump into the Q&A session. Okay, beauty standards. So in our society, beauty is quite high in the ranking of things that occupy us, or that we talk about, or that we think about. And sometimes we tend to think, okay, well, if beauty is too important to me, or if I care about my own looks too much, that I'm a superficial person. Because really, you should not judge a book by its cover, and it's all in the eyes of the beholder and everything. And that also has its grain of truth. But if we're honest, us humans, we are drawn to beauty, not only in each other, but also in art, in nature, in music, everywhere. Beauty draws us in, and beauty has a certain level of importance, right? And um, to think about that, or to want to be beautiful or to seek beauty, is not a weird thing, and it doesn't have to be superficial. Actually, beauty does unfortunately really matter. If we look into research, then people who are generally perceived as beautiful or attractive have a lot of advantages. What you see here is not even all of it. So they're considered more successful in their professional and personal life. They might be their overall well-being might be higher. Beautiful people are perceived as more intelligent. They tend to marry attractive people and are hired more frequently and receive better performance evaluations, and even to a degree where unattractive people are found guilty more often than those that are considered attractive, and receive longer sentences. So being beautiful definitely gives you an advantage in life. And I think sometimes it's even already in the word attractive, right? To draw someone in, to have something pleasing about you. And although we there are certain aspects of what we consider as beautiful that tend to change and can be different from society to society or culture to culture. There are certain things in beauty standards that are quite stable, certain aspects. When we ask ourselves, what is beauty even? Because there is some consensus, right, about certain aspects of those beauty standards, and that's theoretically, I mean, one theory that could explain that is the idea of evolution, and that those beauty standards point or hint towards fertility. So seeking out partners that would, specifically women, that would meet those beauty standards might raise my chance to be able to create offspring and to pass on my genes, right? Because actually, features such as facial and body symmetry or clear skin point towards something like that. Clear skin, for example, also it can be a sign of health. The waist to hip ratio in women is considered a sign of fertility or the ability to bear children. Youthfulness obviously comes with higher fertility, and those are all features in our appearance that are considered beautiful across cultures and across time. For men, it's a little bit different because evolutionarily, their fertility was less of an issue than their ability to provide. So for men, general beauty standards can be muscularity and height because when we were still hunter-gatherers, that would raise man's ability to provide for a woman. And then on top of those fairly stable, universal beauty standards, we do have the cultural beauty standards and also beauty standards that change with time. For example, when we look at Western beauty standards, they were very different in the 50s than maybe today. And the kind of aspect that can be difficult to accept about this is that yes, beauty matters, but we have very little control over it. Although I know diet industry and a lot of other aspects of our society make us feel like we could shape and change the way we look however we want, but in reality, we have very little control over the way we look. And yes, there's other things that also make us attractive, such as self-confidence, humor, being a friendly person, all of those things. But yeah, there's limited control over what we actually look like. It's just something we're born with. What you do have control over and have a certain amount, have the ability to affect in a positive way is your body image. And your body image isn't necessarily correlated with how close you are to some kind of beauty standard. That's very important to know. So body image is the idea that I have in my head of what my body looks like and my relationship to the way I look or the attitude I have towards my own body. So it's not necessarily what I really look like. And we're going to see that sometimes there's a huge gap between what we really look like and what we feel we look like or how we perceive ourselves in the mirror. Body image, yeah, I think the best way to explain it is the relationship we have in with our body and our inner perception of our body. And it is normal to not be satisfied with your body completely. Most people are not 100% happy with the way they look. More frequently, even women. And body dissatisfaction or body image disturbances, as we call them, are increasing. They keep on increasing. They have been increasing in the last decades, and they keep on increasing, which is very likely related to things as social media and being confronted with the way we look a lot, which I'm going to explain why that damages body image. However, there is a slight shimmer of hope. While over the decades, body image satisfaction increases, uh, us in our own lives with age become slightly more happy with what our body looks like. So body image increases over time for a person statistically. So each one of us might be a little happier with what they look like, with what we look like in 10 years than we are now, which is, again, maybe our first official clue that it's not necessarily connected to what you really look like, because generally we don't get more attractive with age. However, body image is not a completely stable thing. Actually, it can not only improve over years and years and years slightly, it can differ greatly from day to day for the following set of reasons. There's momentary influences on body image. I don't know about you, but I know a lot of people who have had this effect of one day you get up and you look in the mirror and you think like, oh, okay, yeah, I look good. And then the next day you wake up, you look at exactly the same body and you're like, oh my God, how am I gonna leave the house? This is horrible. And it's not that you've, morphed overnight into a completely different human being. It's different other things that make you, that influence your body image, the perception that you have of what you look like. So that can be hormones. Your cycle can have a huge influence on that. Physical details such as the lighting in the room, the mirror that you're looking at, the angle from which you look at yourself, but also things like having exercised, having slept well, or being hydrated can make us feel better about our bodies. If we're in a good mood, if we're feeling self-confident, we'll also perceive ourselves as more attractive. And even some styling choices can just make us feel better or worse about our bodies. So yeah, there's a lot of things that can influence the way we feel about our body, which also means we can influence the way we feel about our bodies to a certain degree. So to put those concepts into some kind of visualization and explain to you how I see this in my head, there's your real body, the way you objectively look like in the eyes of most people. Then there's your body image, your very own individual idea and relationship to what you look like. And then there's some kind of beauty standard, and you might have your own beauty standards, your own things, like, the way you wish your stomach would look like or your nose, but also there's those general influences of like youthfulness right now, slimness, things that, generally are considered as beautiful. And we're talking about mental health here, right? So there's two sources for negative influences on our mental health here. So if we feel like the gap between our body image or the way we look and beauty standards is too high, then we can feel bad about that. But also there's this phenomenon of having a really different concept of what we look like than what we look like in reality, like the gap between our real body and our body image. And I'm going to talk about both of those things. Firstly, gaps between body image and beauty standards. So when we talk about beauty standards, what we're really talking about is not some kind of achievable goal. It's unrelenting standards and unattainable goals. So if we strive towards that, we're never gonna fully realize our goal. We're never gonna really get there. That's first of all because beauty standards are not really stable, but also because what we see in the media of beauty standards of beautiful people isn't even real. Those are not really, those people themselves don't really look like that, which is something that fortunately has become more and more common knowledge, but I still wanted to present it to you here. Even the people that we think we should look like don't look like that themselves because of filters and Photoshop and all of those things. And I wish I would have found, this comparison between like the natural look and the makeup and edited look for men as well. I didn't. I'm sure there's a similar effect for some pictures of the men that we see on magazines, it's just a little, I didn't find anything about that online. But for women, there's at this point a lot of famous women that show what they really look like. You take all the filters and the makeup and all of that away. So that's one reason why striving for this kind of beauty is a race you cannot win. But there's one that I find even more important. For me, one of the biggest lie when we look at this topic, which is the idea that the closer I get with my own looks to what is considered beauty, the beauty standard, the happier and more satisfied I will be. Okay, and that is inherently not true. We call this the beauty standard paradox or the aspirational gap. The closer someone gets to achieving an ideal beauty standard, the more they may focus on remaining imperfections and flaws. The closer I get to this beauty standard, the more I will focus on the things that are not quite there yet, and the less satisfied I'm going to be with my results. We know that because certain groups of people, for example, ballerinas, dancers, models, actresses that are supposed to be, or actors, very close to the beauty standard, aren't necessarily more satisfied with their bodies. Actually, certain groups, just like, for example, models, we know from research that they tend to be less satisfied with their bodies. They have more body image disturbances and higher rates of things such as eating disorders. So the idea that if I just get close to this beauty standard, I'm just going to be happy and satisfied with myself. I mean, statistically, right? That might be true for some people, but statistically, it's not true. And you might even do damage to the way you feel about your body. Just like when, you do this diet and then you lose some weight, and then for a short period of time, you're really happy, but then you just have the next goal. You want to lose some more weight, or you think you have to tone your arms, or you think, oh, now I realize there's something about my face that I don't like. It's a never ending race, and you're never gonna really get there and be completely satisfied. Um, if we look at body image in people who suffer from skin picking, Um, first of all, this connection is inherently there because skin picking is a disorder that results from some kind of grooming behavior. And grooming in and of itself is a behavior that we engage in to make ourselves presentable, right? Grooming is an individual or social um, activity that exists also in the animal kingdom, but also amongst humans, that is supposed to make us presentable to society. And we start really taking care of our bodies and our appearance during adolescence. So grooming, learning to groom yourself is something that you learn when you're a teenager. And that's also the time when most people develop their first symptoms of skin picking disorder. So in and of itself, skin picking is really connected to appearance, to concerns about what we look like. And unfortunately, skin picking disorder is connected to body image disturbances. Women and men with skin picking disorder perceive themselves as less attractive than individuals without it. Individuals suffering from any BFRB, any body-focused repetitive behavior, which includes also hair pulling, nail biting, etc., have more body image concerns. But in comparison with all the other BFRBs, for example, hair pulling, people with skin picking disorder have the most body image concerns, even amongst this group. And skin picking severity is associated with body image disturbances, lower self-esteem, lower subjective physical well-being. So not only is skin picking connected to body image, there is a negative connection. The more severe my skin picking, the more disturbances in my body image. Research doesn't really tell us exactly why, but there are a number of reasons that at least I could think of. First of all, skin picking disorder can be caused by dissatisfaction with appearance, for example, acne. Skin picking disorder can lead to skin damage and often permanent scarring, which likely affects how somebody evaluates his or her body. Also, and this is very important, and I'm going to get more into it later in this presentation, individuals who pick their skin tend to spend more time preoccupied with their appearance, and that has an effect. And lastly, thoughts about whether others notice, or the fact that sometimes people just really do notice, and we see it, in their faces and their glance, can reduce feelings of confidence in one's appearance and negatively affect body image, the way we feel about our body. Now, I want to talk also about this second gap, the idea that sometimes my own image of my body, my own thoughts about my body are very different from what objectively my body really looks like. And we call that body dysmorphia, when there's a big gap between my perception of what I look like and reality. And body dysmorphia is a phenomenon that can occur in a number of psychological disorders. It's very, very common in eating disorders such as bulimia and anorexia. There, we see it mostly related to weight. So someone can be very anorexic, very underweight, stand in front of the mirror and still really honestly, not lying, not exaggerating, perceive themselves as fat. There's certain experiments that we sometimes do in therapy to kind of make people who have those eating disorders understand what's going on. And one of them that can be very interesting and impressive is you put a rope on the floor and then you ask the person who has the eating disorder, take the rope and define with your hands a certain amount of the rope or a certain length in the rope that you would need to wrap it around your waist, right? Just estimate it without really wrapping the rope around your waist. And usually the part of the rope that people define is much longer than you would actually really need to wrap around your waist, because the idea I have in my head of what my waist looks like is very different from reality. So that's body dysmorphia in eating disorders. But there's one disorder where body dysmorphia is literally the whole disorder. It's the main symptom, and that would be body dysmorphic disorder. That is a disorder that in the DSM is in the same classification group as BFRBs or OCD. And it's a condition characterized by intense and persistent preoccupation with perceived physical flaws that are often minor, non-existent, or at least unnoticeable to others. But for people who have body dysmorphic disorder, they spend a lot of time obsessing over those flaws, thinking about nothing else, and also engaging in compulsive behaviors such as checking themselves repeatedly, seeking reassurance, social comparisons, and things like that. BFRBs are not solely driven by appearance concerns. However, they do involve a certain amount of wanting to improve something, fix something, or perfect something about, for example, my skin or hair. And interestingly, there's also quite a lot of overlap between BFRBs and body dysmorphic disorder, specifically for skin picking. Now, so let's look into that for a little bit. So if you have body dysmorphic disorder on one side and skin picking disorder on the other, there's symptoms that appear in both of them. For example, an intense worry about a specific body area, in this case, oftentimes the face, comparing your looks with other people's, mirror checking, trying to conceal perceived flaws, and skin picking is a symptom of body dysmorphic disorder. It's one of those compulsive behaviors that I do to fix some perceived flaw. Now, not surprisingly, some kind of skin picking behavior occurs in between 26 to 45% of patients with body dysmorphic disorder. So 26 to 45% of people with body dysmorphic disorder pick their skin. If you take it the other way around, 29 to 32% of individuals with skin picking disorder have body dysmorphic disorder. So this is one of the most frequent co-occurring problems that you might have if you have skin picking disorder. Now the question is, why? Why would I lose, the sense of this? kind of, why would my own idea of what I look like be so far away from reality? Why would my image of my body would be so distorted? Like, where does this come from? I mean, we're not born this way for sure. It's not like some visual, uh, some problem with our vision. And in my opinion, it comes from the compulsive nature that we see in both of those disorders, and I'm going to explain to you why. So first of all, when I talking about the compulsive nature, what I mean is this cycle of feeling an urge or wanting to, for example, pick my skin. The trigger for that can be an intrusive thought about a perceived flaw if I have body dysmorphic disorder, or it can be something else. Can be all kinds of things for skin picking disorder. Anyways, so the urge comes up. I want to pick my skin. I then do it. I feel a certain level of relief, but then it makes the likelihood for me to repeat the cycle higher. And in the long term, I also feel bad about what I did, the fact that I picked my skin. And what that creates in the long term is that I become preoccupied with the spots on my skin, with the way my face looks, with the way my skin looks. And I keep on checking and I keep on picking and I keep on doing something about it. And the fact is, the more I check on some aspect of my life, it doesn't matter what it is, but in this case, it's my appearance. The more concerned and unsure I feel about it. The more I look at my skin, the more flaws I will find. So this preoccupation makes me less sure of what's really going on, of how beautiful or not beautiful my skin really is. And it makes me find more and more flaws. Almost the same effect that we know from OCD. So in OCD, we know from research that, for example, if my OCD is I have to go back to check the stove, we know that I will be more sure of the fact that the stove is turned off the second time I check than the 10th time I check. So checking again and again and again makes me actually less sure of what's going on with the stove, which is totally paradoxical, but true. And the same, I think, is true if we are too preoccupied with the way we look and specific aspects of our appearance. So I think body image disturbances or having a negative relationship with my body can be due to the fact that the way I look is really far away from beauty standards, but also a huge influence, maybe even bigger, is how much I actually am preoccupied and how much I think about the way I look. So, in my opinion, preoccupation with my appearance is the main culprit for feeling bad about my body. People who look better, as I mentioned, aren't necessarily more happy with our bodies, but those groups that I mentioned before, right, that you think, wow, usually they're very beautiful models, ballet dancers, actors, why aren't they more happy with what they look like? Why? Because their job forces them to be preoccupied with the way they look all the time. If I'm a ballet dancer, I will look at a mirror and at my own body in the mirror for hours at a time. If I'm a model, I will be confronted with the pictures that are taken of me all the time. The same goes for actresses. And that's why those people can be very, very beautiful and still very unsure about the way they look. So any kind of preoccupation with the way you look um, might eventually make you feel much worse about the way you look. And that can be diets, beauty magazines if you're old school, or social media, generally comparing your body to other people. Mirrors are such a huge culprit. We spend so much time in front of mirrors these days. Used to not be that way. A couple of 100 years ago, people wouldn't have mirrors at home, right? My guess is they had less body image disturbances. I mean, we see that they increase over the decades. Certain clothes that I have to adjust, where I have to check if it's in the right place, will make me preoccupied with the way I look. Video calls, all of this, all of these effects of COVID have really devastating effect on our body image. When others talk about their body and when others talk about our body, that's going to direct our attention towards our body and the way our body looks. Having our pictures taken, focusing on specific body parts, the ones that we don't like, and also trying to fix things in our appearance. All of those things, for example, brushing our hair repeatedly, or picking our skin until it looks smooth. Those are things that make us preoccupied with our body and eventually have a really negative effect on our body image. So the answer, if you want to improve your body image, is do that less, right? And interestingly, that is a part of evidence-based treatment for body dysmorphic disorder and skin picking. So what we do here at Skin Pick, for example, stimulus control techniques, that includes dimming the lights in front of the mirror, reducing time in front of the mirror, reducing selfies and video calls. There's something therapeutic in that, and we would do the same for body dysmorphic disorder. But I have just a few additional thoughts on what you can do to improve your own relationship with your body. Let me just check. Oh, actually, I have a lot of time left. That's nice. This advice on how to find a healthy relationship with your body is not really based on an evidence-based research protocol as we have them. For example, if you want to treat depression or some kind of anxiety disorder. Unfortunately, we don't have that to treat body image because poor body image is not really considered a mental disorder. It's just something that you find in a lot of places and with a lot of clients. So this is basically like some evidence-based stuff, but most of it is just what I found is really helpful for my clients. So that's what I want to share with you. And I want to take one moment to just talk about body positivity because it is an important concept when we talk about body image. It's actually a whole revolutionary movement that really, I think, advanced us when we talk about body image in general with really good intentions, namely the acceptance of all bodies regardless of size, shape, skin tone, gender, and physical abilities. A really amazing idea. The idea that you are allowed to and can love your body no matter what it looks like. You don't have to be close to some kind of beauty standard to be able to love your body, or to be allowed to love your body, or to be allowed to present your body and be proud of it. So it's a really beautiful idea. However, for a lot of people I experience, it feels just like the next unattainable goal. So, for example, if you're a 90s kid and all your life you were basically taught to not love your body unless you're a certain weight, unless you've shaped or toned your body in a certain way, unless you have a certain size, a certain face. And now all of a sudden you realize, oh, that might be not that important. Now I have to love my body, but all this critical attitude towards your body is so deeply implemented and internalized that you really can't. And then you feel you're failing at yet another thing. And it can push people into trying to feel something that they don't, right? And worst of all, I'm still preoccupied with the way I look. Just now, I look at myself in the mirror and I'm trying to love myself and I'm trying to love every gram of fat. And again, it is a beautiful idea and it works for some people, but for a lot of people it doesn't. And that's okay. A concept that I find much more realistic is body neutrality. The concept of body neutrality is often attributed to initiatives from around the 2010, so it's fairly new. And it's an approach where we say, you don't have to hate your body, you don't have to love your body. We're not emphasizing positive or negative feelings about our body. It's more of a neutral, acceptance-focused mindset. So what you're really doing is kind of changing your perspective about your body and your expectations of how you're supposed to feel about your body. When I was preparing this presentation, I was reminded about a really beautiful post that I saw on Instagram of an actress that had just given birth. And she used this concept of body neutrality to shift her focus or reframe her perspective on her own stretch marks. And she had like this really beautiful new way of how to call them, not stretch marks anymore. And I didn't remember what she called them. So I searched her profile, but I couldn't find it. And then I just Googled it and I thought maybe, maybe it got viral and maybe I'm going to find it somewhere. I didn't. And what I typed into Google, which I'm showing you here, is reframing stretch marks. And not only the first results that you see here, but basically all of the results that I found were not, how can I have a better relationship with my stretch marks? They were all stretch marks. Where do they come from and how can I get rid of them? So it's again this focus on making everything about your body perfect and concealing or getting rid of every flaw. Which is funny in this case because, as to my best knowledge, I'm not a doctor. You cannot get rid of stretch marks. They either go away or they stay, but it's not that you can put a lotion and then they just go away. So it's even a lie, right? So if you want to redefine your own relationship and the way you think about your body, you have to do it yourself. Like the internet will not be such a great source of help, I guess. So here are some thoughts of mine of how you can reframe and switch your perspective in terms of your own body. So instead of hating your stretch marks and wanting to get rid of them, you can ask yourself, what story do your stretch marks tell about your life? Where do they come from? Why did your belly have to expand? And what beautiful thing, came out of it in the end? How many days and nights has my skin seen together with me? What a companion. How many miles have your legs carried you over the years? How many things can your hands create? And what does it feel like for another person to rest their head on your belly? Right? Those are different ways that you can look at your body where you don't have to find it beautiful or ugly. You can just be grateful for the fact that it is here and it's taking you through your life. I also want you to be really mindful and careful about the way you think about your body. You talk about it in your inner dialogue, right? When you just kind of focus or get into some kind of all generalization or black and white thinking when it comes to your body, you remind yourself, I am much more. I'm not my hair. I'm not my bald spots. I'm not my cellulite or my acne or my scars. I'm so much more. And that might seem simple, but it's actually quite revolutionary, specifically as women, if we think about how we're judged, in public and how we see other women judged. You see here this picture of the Kardashians, each one of them with kind of like a tag of their weight. And you might think, well, that's weird. Why would I judge them by their weight? But for everyone who grew up with those same magazines that I grew up with, that is so common to see, you know, celebrities being reduced to their weight and how this one, oh, she gained so much. She was 56 and now she's 72. Or this is the secret of how that actress lost so much weight. And this kind of being defined by the way you look or how much you weigh is really problematic. So it's hard work to switch your focus. One initiative that I really like, where I also got this picture, right, is the I Weigh initiative by Jamila Jamil. She apparently also got annoyed by the standard of being judged solely based on your appearance, and she started this I Weigh movement in order to reframe and think about, what do I really weigh? What's my weight? What defines me? And it really caught on, this idea, and a lot of people posted stories or pictures of themselves with what is really important to them and what makes them, special. And I thought, as like one practical idea that you can take home, I want you to think about what you weigh. You can even take a picture of yourself and write it down for yourself. You can journal it. You can think about it. What are the things that make you important that are not your appearance? Is it the people who helped you become who you are? Is it the people that love you? The things you did that you're proud of? The challenges in life you overcame or still cope with, but you're not giving up? The things that make you happy, the person you are to others, a father, a mother, a brother, a sister, a friend, a partner, a teacher, a nurse, whatever it is, and your strengths. I think it's a really beautiful exercise. You can just like, you have the stereotype of putting pictures of yourself on the fridge in order so for you to not, go for the next snack. You can put that on the fridge to remind yourself that it sometimes whether you eat the next snack or don't is not so important. Okay. Let's conclude. Beauty is not something that is superficial or vain to think about. There are evolutionary and cultural beauty standards that make a difference, and wanting to feel beautiful is not vain. It makes sense. So don't judge yourself for it, but it can mean that you're setting yourself up for a race that you can never win. The way we feel about our body is not stable and influenced by many factors, not necessarily only by how attractive we really are. Preoccupation with our appearance can lead to low self-esteem, lack of self-confidence, and body dysmorphia. The way you look or your perceived flaws don't define you. There's much more important things about you. And attaining a better body image is through changing focus and mindset, not through making yourself look better or believing the idea that you can change the way you look however you want. Um, If you want to follow us and stay on track of what we're doing, then you already obviously know that we have monthly webinars, but also I want to invite you to check out our website. We have forums there and blog posts that we update all the time. And we're also available on all the social media channels. Those are a beautiful way to find community, and they are a comprehensive center for information and treatment options. If you want to sign up for SkinPick, then I have the discount code that I mentioned before here for you, webinar 100. It's going to give you a $100 discount for the first month of your subscription. Okay, so that's it content-wise for today. Now would be an excellent time for you to write down questions in case you have any regarding the presentation, something that wasn't clear. Oh, very good question. Thank you. How can we watch the replay? So all of our webinars, and we have quite an extensive library of webinars at this point, are on our YouTube page, skinpick.com. Also, you can find all of our webinars on the website that I mentioned, www.skinpick.com. So you can rewatch all of our webinars as much as you want. Thank you for asking. I forgot to mention that. Okay. When will this webinar replay be uploaded? Usually, I mean, now where I live, it's already late. I'm guessing within the next 24 hours. Yep. Any more questions? Or was I so clear today that no question marks remained? Ah, thank you. This was great. Thank you for the feedback. I was already wondering what's going on. Usually I get so many questions. Okay, there are a few more. Just would like to thank you. Oh, thank you so much. I'm really happy. I really like it's really meaningful for me, by the way, those webinars, and I really hope that you guys are able to take something away from it. Is it likely to have another body dysmorphic disorder in place of skin picking? Um, once recovery is happening or in the process, I mean, likely to have another body dysmorphic disorder in place of skin picking. So skin picking is is not a body dysmorphic disorder. Body dysmorphic disorder means that you're preoccupied and consumed by some um, perceived flaw, right? And that perceived flaw can be that your skin is not smooth or not or uneven. And that then the picking of the skin would be a symptom of your body dysmorphic disorder. And it can be skin picking disorder at the same time, but it can also be just a symptom of body dysmorphic disorder. Um, once recovery is happening or in the process. Uh, I'm guessing your question is whether the preoccupation can switch from one perceived flaw from the skin to another one. I hope that's the question. Yes, that's it. Thank you for the feedback. And yes, it can. We also know that people who have, for example, skin picking disorder can at some point develop, for example, hair pulling disorder. Also with body dysmorphic disorder, a lot of the times it's not one perceived flaw per se. It can be one. For example, I had a client whose perceived flaw was that his hands were very small. I mean, they weren't really small, but in his head, they were really small. Or I had one client where they felt that their face was very asymmetrical and they looked disfigured because of that. But many times it can be many flaws, and there can also be fluctuation in the flaws. But if you're talking about recovery, then the strategies that we use to deal with body dysmorphic disorder or BFRBs for that matter count for all of the areas, right? So if I learn to manage, for example, skin picking disorder, then I already have some tools in my toolkit in case I develop another BFRB. And if I learned how to deal with one perceived flaw in body dysmorphic disorder, I can transfer that knowledge also to another one. Okay. You're mainly talking about skin picking, like the face, due to preoccupation with appearance. But mine is extreme picking, pulling skin on fingers and around nails, also pricking at wounds, not allowing them to heal. It doesn't feel like the same motivation. It's more about feeling bumps and irregularities and not appearance. That is a very good point. You are completely right. So, and that's also the difference. So skin picking symptoms in body dysmorphic disorder are always about appearance. But if it's skin picking disorder, it doesn't have to be appearance. That's why also there is overlap. But there are people who have skin picking disorder that have no dysmorphia whatsoever. They might not even have body dysmorphia. Jesus, what's going on with my language? They might not even have body image disturbances. For them, it can be something completely different about the feeling they have when they feel the bump on their skin, or the feeling, or if there's a loose piece of skin and you don't like that it's there and you just want to fix it, or you don't like how it feels. So it can be something completely different that is not related to appearance at all. This whole webinar is about the fact that there is some overlap and some connection, but it doesn't have to be there for everyone who suffers from skin picking disorder. So this is a very good point. Thank you. I'm a clinician, behaviorist, and psychotherapist. I was wondering if you offer any training for professionals. Thank you. So that's a huge compliment that you're asking, first of all. Um, Unfortunately, at this point, we're not offering training yet, but we are thinking about it, and it's definitely a plan that we have here at SkinPick, and our other program is called TrickStop. So keep your eyes open. We do know that there is lack of training opportunity places where you can have training specifically, for example, for BFRBs. We are aware of that, and we're thinking about how we can, offer something in that direction. But it's not going to be in the next months. But yeah, follow us, please, and maybe we're going to have that at a different point in time. Um, what about skin picking to anorexia, for example? You mean that once you recover from skin picking, you might develop symptoms of anorexia, of an eating disorder? That's not a connection that I've stumbled across, neither in research nor in my private practice, or as my work as a therapist in my work as a therapist in skin pick. I think if you have skin picking disorder and then recover from it, or if you have skin picking disorder and then develop anorexia, I mean, there is some comorbidity, but they're also very different. Now, the same person wrote, I was thinking because it's still body dysmorphia from one thing to another. Yes, but like the body dysmorphia in anorexia is very specific and very, very, and related only to weight, right? So it's only feeling fat when actually you are very, very thin. So really there's less overlap there. I just mentioned anorexia because you have the body dysmorphia there, but it's not the body dysmorphia that you usually see when you see body dysmorphia and skin picking disorder, and also not body dysmorphic disorder. So it can happen, like a person can definitely have skin picking disorder and anorexia, but you would expect that most of the underlying factors that cause the eating disorder, for example, are very different from what causes the skin picking. Another question. Have you thought of changing the name to disorders of skin picking to focus less on what we are tempted to do? You mean change the name from skin picking disorder to disorders of skin picking? Can you maybe elaborate on that question? I'm not sure I understood. Focus less on what we're tempted to do. I do not like to hear skin picking because that is what I'm trying to curb or stop. So you mean for you to hear skin picking spoken out loud is an actual trigger because it reminds you and it might bring up an urge. Yeah, that makes sense. But I mean, like I have to call it by some kind of name, right? There's different names, right? I could call it excoriation disorder or dermatillomania, but I think in the end, even if I would find a different name, eventually, that's how our brain works, right? It will connect it to the skin picking anyways, even if I don't call it that way. Um, which I totally get your point. I just think if I would find a different name, um, eventually it would have the same effect. I do wonder about the name though sometimes. So lately in my webinars and also in my work, I've started calling it only skin picking disorder because I found dermatillomania and excoriation disorder so academic. and sometimes different to just say in a sentence. But also, I'm guessing that skin picking disorder is a little more triggering than this kind of foreign way to call it, this ancient Greek dermatillomania. But I think eventually it's just all going to remind you of the fact that you're trying to curb this and still you're tempted to do it. I am not sure this would have any effect. All right. I think that's it for today. Thank you so much for those wonderful questions and this feedback. I'm just going to repeat that if you want to rewatch or send this webinar to another person to watch, then you can find it on our YouTube channel and even on our website, skinpick.com. As we are all in different time zones, I hope you have a nice rest of your day wherever you are. And I really hope I'm going to see you around for the next webinar. Thank you so much.